The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, all of you TMD warriors out there. Welcome. We are gathered here today for the next episode of TMD Demystified. I am Tony Urbanek. Welcome to this episode, which is going to have a unique name, as most do. I hopefully find this stimulating and a little interesting. Kind of on a non-serious note, but yet kind of creative. Hopefully will make you think a little bit about your role in the treatment of TMD, or your not role in the treatment of TMD, because we're here to talk about all aspects, both clinical, non-clinical, social, economic, marketing aspects of this huge problem. I've commented so many times, it's a huge problem. Literally 45% of the female population has TMD. Most of them are undiagnosed or misdiagnosed. I think the literature points out that usually 20 to 30%, but those are only the properly diagnosed cases. But the point is, it's a big, big problem. So here's the question. It's a what if. What if all the ENTs or PCPs or convenient care clinics, either one or all of the above, constantly send you TMD patients? Think about that concept, because it's actually very real. The potential for it is actually real. How do I know it's real? Because we see that here in our practice here in Brentwood, Tennessee, all the time, consistently. We don't see every convenient care PCP, ENT outlet sending us patients, but we see many, 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 many. And so let's just repeat the what if. What if all of the convenient care clinics, all of the PCPs, all of the ENTs in your specific geographic area sent you TMD patients? What would that mean? What would that mean in the three categories that would be meaningful? Because I broke it down into the different categories. Because we know it's possible. And so if you wanted to do this, then you need to know what it's all about and why you do it, what you'd be opening up your practice for, and the consequences. All of them good. I can't think of any bad consequences unless you did not want to be busy. But what are the benefits of having that happen? And then we'll talk about, well, how you do that. What does it mean? Well, what are the benefits of what if that occurred, like we have here in Brentwood, Tennessee? Well, what would be the benefits to you and your practice? What would be the benefits to the patients? And what would be the benefits to actually the providers, the PCPs, the ENTs, the convenient care clinics that sent you the patients? Well, each one was a different category, and each one has a different answer. So the benefits to you, the doctor, is multiple. Number one, a lot more patients. And I don't know of a professional practitioner on the dental side that doesn't want more patients. Whether you're a specialist or whether you're a generalist, that's the name of the game, is getting more patients. Now, we'll kind of skip over, well, I don't know whether I want to see TMD patients because they're problems. Well, I've covered that so many times. please run down the list of topics, titles on other episodes in this podcast and pick out one or two of them that address that issue. They're easy to find. And you can find out how treating TMD is not complicated. It is actually quite easy. It is quite methodical. There's a whole process to it. It's very simple when you learn about, number one, the problem, and number two, about the process. But just take it for granted that it is fairly easy to treat, won't take much of your time, and that you would end up with a lot of patients. So the benefits are, number one, patient load. Now, if it takes you roughly 45 minutes of your time to run through consultation, delivery of the device and protocol, post-insertion checks, maybe 2 times, maybe 3 afterwards, and the whole process takes you 45 minutes. It's not a long process. So that is a benefit. It's not a complicated treatment plan, start to finish. But as far as the patients coming in, they, number one, it is not connected to insurance. So you do not have to deal with insurance plans, policies with patient. It's a service that is a patient service, cash only. Number two, when you make the patient successful and out of their symptoms, most of them have a tremendous amount of pain or other symptoms, they are very, very pleased, very happy, and you are elevated to the point where they think a lot of you in your practice, and most of them convert and ask you if you could be their dentist if they come from another dental practice, because they certainly trust you, they certainly believe in you now when you've made their symptoms, which has run them ragged for anywhere between a year and, I had one yesterday, 50 years of headaches, which were obviously caused by temporomandibular joint inflammation, obviously. And I have had several patients with 50 years of history. Now, most of them don't have 50. Most of them have anywhere between 10 and 30. And it is really rare to find somebody except a 15 or 16-year-old. There are plenty of those that are just starting out with the problems. But most of them are well into the series of progressive events that leads them to treatment. And they've seen, by the time, roughly half the patients we see in our practice have been to multiple practitioners before they make it to our door. And roughly half of them, maybe a little less than half, have not seen any other practitioners by the time they're referred in. And that is because there's so many doctors out here in Middle Tennessee who now are beginning to recognize these symptoms and send them directly without putting them through a chase between different practitioners and x-rays and all kind of treatments that are not effective. So, number one, it's a very substantial increase in your patient flow to treat the problem. It's a substantial increase in the ability of your practice to present a strong PR position and recognized by the patient as trustworthy and successful to the point they want you to be their dentist. And of course, then they talk to their friends, and it's a huge practice builder, besides the fact that it's not encumbered by insurance. So those are the practical nature of what would happen. Now, how many of those patients actually can occur? Well, you can actually be quite overrun with them depending on how much outflow you make and present to those kinds of practices, which we do quite a bit here in Middle Tennessee in our practice. But it is successful to the point where we gain, on average, 10 new referral sources per month. And at least half of those are convenient care clinics, PCP, and ENTs. Those are new referral sources. And then we've now accumulated well over 800 individual doctor practice referral sources that refer us TMD. So it definitely is possible. Treatment is fairly simple. You have to understand what you're doing and why it is so successful, and then follow the protocol. All right, so what would that mean to the patients themselves? Well, I kind of already touched on that, and that is it allows them to quit running around in circles, not be run around in circles, pointed from doctor to doctor, or from potential treatment that is not successful. And it gets them to understand that the second is that dentistry has a lot to offer besides fixing their teeth or straightening their teeth. It is a healthcare profession, and there's nothing more direct about healthcare than getting patients out of pain of various kinds, whether they be the symptoms associated with TMD, headache, earache, jaw pain, neck pain, shoulder pain, arm, hand, finger tingling and numbness, or any other kind of symptom. And then thirdly, the benefits to the clinic itself, which sends you in, because these doctors and clinicians and nurse practitioners and physician's assistants, I can assure you, based on what I have observed lecturing to those groups, sometimes large groups, state associations of physicians' assistants or nurse practitioners, or large medical groups of PCPs. I've done lectures to all of those groups. They are fully engaged with trying to figure out what to do with patients that come in with these strange symptoms that they consider strange. And why are they strange? Because they vary so much over the body. One day it can be a headache, next day it can be a jaw pain, described differently by patients as sinus pain, as dental pain, as shoulder pain. Sometimes it's recognized fairly easily if the patient says, I can't open my mouth all the way. Well, the practitioner will immediately think dentist at that point in time. I can't open my mouth. Well, you need to go see the dentist. But those are not the majority. The majority of these patients present with these various symptoms that are very confusing to the medical profession. And they are the first to tell me that they are more than interested in trying to figure these symptoms out so that they can have an appropriate either treatment or referral and know exactly what to do. So that is a benefit, major benefit to the practitioners themselves. They're good people, they're good practitioners. They really want to do what's right. They just don't have enough information. They don't understand enough about the origination of the symptoms, which is inflammation within the temporomandibular joint itself, and how to diagnose it. And it's easy to make your diagnosis once you have a list of relevant symptoms and then put pressure on the joint itself from the open and closed position, and it hurts, the joint's inflamed and you've made your diagnosis. So what if all of the convenient care clinics in your neighborhood, all of the PCPs in your geographic region that you want to draw from, or other medical types were referring you patients? Well, you would be very busy, and you would get to the point, I'm sure, where you'd need to grow your practice one way or another, whether it be by adding more time or more associates, or wanting to add a different location or additional location. That really is the ultimate what would happen, because you'd be inundated with so many patients. I can't believe that there are many of you out there who do not want that to happen. But on the other hand, it doesn't happen in a day. It doesn't happen in an instant. I'll be very frank and honest. It's taken the better part of 7 to 8 years for us to develop that referral list of over 800 practitioners. So it didn't happen overnight, for sure. But it's very, as I've said many times, very satisfying personally from a physician's point of view to actually solve this problem for patients. They're very grateful. There's hardly a day goes by where a patient doesn't look at me from the chair or get out of the chair or talks to me as they leave and thank me profusely as to handling their symptoms and handling this problem profusely. I had one lady yesterday who thanked me. I had one lady yesterday who thanked me just because she said, "You understand this problem. You're the first doctor I've seen that understands this problem." And all I did, we had finished the consultation, and she said that she would proceed with treatment and get the device and protocol. And as she left, she thanked me greatly for just understanding the problem, and she was so looking forward to getting rid of her symptoms. Thank you, thank you, thank you, as she walked down the hall. Happens all the time around here. I don't know, maybe that doesn't appeal to you. It definitely appeals to me. So what would happen? What would it mean to you in your practice? Well, kind of get creative about it. It definitely is possible. And how do you do that? Well, to do that, you need to become familiar with the cause, which is inflammation within the temporomandibular joint. You need to be familiar with why unloading the temporomandibular joint with a device that disoccludes the posterior teeth according to a protocol, relatively short protocol. Protocol is 24/7 for the first 2 months, rarely changes, although it's not written in stone, and then nighttime indefinitely for the rest of the patient's life. I know everyone's first question, dental question, when that is stated, is what about supereruption of the posterior teeth? If you disocclude the teeth, well, you get disocclusion, but it takes a while. And in an adult patient, you will not see supereruption within 2 months because they still have to take it out to chew, to eat. And a good portion of the day, at least an hour or two of the day, is involved with doing that. So it isn't total 24/7 disocclusion. And then once you get into nighttime, they only wear it at night, and you have 2/3 of the day where they're definitely in occlusion or continue to brux. They're not going to stop bruxing. They're going to brux, and you will not get posterior tooth supereruption. So it's quite simple. The whole process is simple. The growth in the practice would be obvious and very simple, and that's what would occur. And then you would tap into a whole different level and list of potential referral sources, other than, referral sources from your marketing, from your ads, from your social media. You would have a bona fide, repeatable referral source from other medical practitioners, of which probably very few of you who are following along and watching this presentation, very few of you currently have referral sources from the medical profession. So being both a physician and a dentist, I understand the dynamics involved here. I understand the desire to expand a practice, and I understand the interaction between dentists and physicians. There isn't much is the answer, not much, except when it comes to TMD, and of which a physician does suspect TMD, his first response, although he understands very little about how it works and what to do about it, his first response will be, well, we must go see your dentist. And then they go see a dentist and go down the rabbit hole of doing things that are not effective, which I will leave unenumerated. Just leave it unenumerated for the time being, but I've spoken on it before. So I just brought this up to put the concept in your mind that number one, it's possible. And for you to, if you want to use the word consider or dream or put it in your list of want to do's, that you can expand your referral sources tremendously if you wish by directing your communication to physicians and physician types. How you do that marketing wise, we have that worked out. I've gone through it before. I'm not going to go through it extensively again, but it has everything to do with informing the dentist, informing the physicians that patient has seen in the past for any reason, but especially for the symptoms at question, the symptoms the patient has, informing the physician at certain points in the treatment protocol how well the patient is doing, how much of the symptoms are decreased, and according to the patient, not the provider, according to the patient, what percentage of the symptoms are now diminished or decreased, and enumerating those symptoms that are now gone. This educates the provider. It educates the physician, the walk-in clinic nurse practitioner, the ENT, exactly what the symptoms are and exactly how well their patient is doing now under your care. And then they send you loads of patients afterwards. It's that simple. And that's how it's done. And we can take you through and walk you through the steps in that process very easily. I want to take the opportunity to encourage our listeners, viewers, to make comments or criticisms of what I have to say, what I have to teach, what I have learned, and what I hope that you are learning and apply to your patients. Actually, after doing these episodes for almost 2 years now, it is obvious to me that I don't get a whole lot of criticism. I get no criticism, and I have very few comments. And I would like more. I encourage you to make comments and criticisms if you feel the need to. No problem with me, and I'll respond to each and every one of you if you'd like. If you'd like to learn more about the Urbanek device and protocol, which I hope you will be seeing more frequently in the dental literature in the very near future. If you'd like to learn more about what I've discovered, how we treat patients, the device itself, and the protocol involved, I can be reached at Tony at tmjservices.net. My director of marketing and education can be reached at Naomi at tmjservices.net. Our website, www.tmjservices.net, is available to you, which will give you significant more information about our company, what we do, and how we're here to help you. So until next time, I look forward to talking with you again. We'll pick a little different topic to encourage you to add or understand TMD a little more in your dental practice. I'm Tony Urbanek, and this is TMD Demystified.